They can't do tip to tip, they would touch pad to pad. Pad to pad, okay? That would be a positive test for the pinch grip test, which is compression of the interosseous nerve.
Conduct the test, the patient is in standing or sitting position and is asked to maximally flex both wrists while pressing the dorsal side of both hands against each other and to hold this position for 1 minute. In a positive test, the patient's paresthesia in the distribution of the median nerve will be reproduced, namely tingling in the thumb, index and middle finger and/or the medial half of the ring finger.
Should be seated in a neutral position. The wrists are going to be extended to their maximum amount and the palms pressed together. And this position is held for 30 to 60 seconds. We are looking for pain, numbness, tingling, or burning along the distribution of the median nerve. This distribution area would be the thumb, the index finger, the middle finger, or the side of the ring finger next to the middle finger. Again, this position is held for 30 to 60 seconds. If a positive finding should occur, it indicates carpal tunnel syndrome.
To perform the drop arm sign, have your patient in standing or sitting position and bring the affected arm into 90 degrees of abduction and external rotation passively. Then tell your patient to hold this position and release your supporting hand. This test is positive for full thickness tears of the supra and infraspinatus if your patient is unable to slowly control the downward movement. Thus the name drop arm sign. Test, have your patient in standing position and fixate the humerus while you palpate the lateral epicondyle. Then passively pronate your patient's forearm, flex the wrist and extend the elbow fully. This test is positive if your patient complains about sudden pain at the lateral epicondyle. Okay guys, this was the Mills test for lateral epicondylitis. To perform the test, have your patient in a comfortable position, stabilize the humerus and palpate for the lateral epicondyle. Then ask your patient to pronate his forearm and then resist extension of the third digit of the hand distal to the proximal interphalangeal joint. This test is positive if your patient complains about sudden pain at the lateral epicondyle. Accurately. To perform the test, have your patient's affected extremity extended so that the wrist remains at the edge of the treatment table. The arm is positioned with the ulnar aspect of the forearm on the table and the ulnar aspect of the hand hanging off of the edge. The forearm is maintained in neutral. In the first step, the patient's pain is assessed with gravity-assisted, gentle, active ulnar deviation at the wrist. This version is suitable for patients who present in the acute phase. This test is positive if the patient reports pain aggravation at the tip of the styloid process. If version 1 does not elicit pain, gently apply an ulnar deviation force to the hand, which results in increased passive stretch across the first dorsal compartment. Again, this test is positive if the patient reports aggravated pain over the styloid process. If the second step is still not provoking, we will perform the original version described by Finkelstein et al., which is suitable for patients in the chronic stage that are unlikely to experience substantial pain in the first two steps. In this third step, grasp the thumb and then passively flex it into the palm. A positive test result is recorded if the patient experiences increased pain over the tip of the styloid process.
To examine for the painful arc sign, instruct the patient to slowly abduct the arms with the thumbs pointing upwards. The painful arc is characterized by a painful trajectory, usually between 60 to 120 degrees of abduction, with less pain at the beginning and end ranges of motion. Pain at 170 to 180 degrees of abduction is seen in patients with shoulder complaints due to a C-joint pathology. For the Epley scratch test, the patient is going to try to bring the hands together on the back while one hand comes from above and one from below. The patient should repeat the movement with switched arms while you are going to check for differences. It is often seen that the dominant side shows more restriction
of carpal tunnel syndrome. To perform the test, tap over the carpal tunnel at the wrist. McGee suggests to tap along the whole distribution of the median nerve, from the index finger towards the elbow. The test is positive for carpal tunnel syndrome if tingling or paresthesia is felt in the thumb, index finger, middle finger and lateral half of the ring finger, which is the distribution of the median nerve.
Sign test. You're going to have the patient make a fist and you're going to be looking at that third metacarpal. You want to make sure it's higher up. If the third metacarpal is level with the second and fourth, then it is positive test for a dislocated lunate.